Hey, what's up guys? Dr. Carl here again. Today's episode is going to be about elbow pain. Specifically if you have pain right around this area and then kind of going down here. And it's mostly painful when you do this motion of your wrist, or you're gripping things, or you're moving your wrist this way.
Pagkatapos kapag kinabangan bigla lalayo, kaya wag nang uulit pa,
Hey guys, how's it going? I transferred inside because my main purpose was to go outside to enjoy the sun, but it was a little too loud. Back to calming down the inflammation. Before you do anything else, it's really important to calm everything down and to reduce the pain as much as you can. I'll just be straight up with you guys. It's one of the more harder conditions to treat because it's a wear and tear issue. It's a wear and tear of your tendon, especially if the root cause of the problem is your job. For example, if you type a lot, or if you have to hold tools and you have to use your elbow all the time, I understand that you have to work. We all have to work. We have to eat. If it's a wear and tear issue, then normally you have to calm down. You have to reduce the frequency of the activities that you're doing. But then you can't do that because you have to go to work. So that's why this condition is a little bit tricky to treat. But don't worry, I have tricks up my sleeve and things that I would recommend you guys that you could use. Number one, I used to use ice. I recommend using an ice massage. So you're simply massaging the inflamed area with the ice to calm down the inflammation. So a good way to do that is to put water inside a Dixie cup, or any kind of like a cup like this, or like a little cup, even smaller, right? I don't have that, but you get the idea of getting a smaller cup, so you could fill it with water and then you freeze it. That way you can tear out the cup, and then you can hold the cup at the bottom, and then you could massage the inflamed area while you're holding onto the cup. If you have a big cup like this, I would recommend cutting it probably about a fourth of the way. Then it becomes a little cup. You put water inside, you freeze it. Then once you have the ice inside here, you could hold on to the bottom of the cup, and then you could use it to massage yourself. If you don't have these kind of cups, then you simply grab ice and then grab a towel. Basically, you're just massaging the inflamed area with ice, directly with ice. So once you're doing the ice massage, you'll feel, you're just gonna feel cold, then you're gonna feel a little bit of burning sensation, then it's gonna ache, and then it's gonna go numb. So it's very normal to feel these things. I would recommend start out with 2 to 3 minutes, and then if you could handle it, you can go up to 5 minutes. And then I would do it 2 to 3 times a day, or even 4 times a day, as long as it doesn't hurt you or it doesn't burn you in the process. If you're intolerant to cold, then I would advise you to not do this. But if you're okay with that, then by all means. After the ice, you can use a brace. Use a brace for your elbow. You can get that brace in Amazon. You can get it at your local pharmacy like CVS. Try Walmart. The main purpose of the brace is to add compression, and that should help you out, especially if you use your elbow a lot. The second thing that you can do is pain medications. So I would recommend using acetaminophen. Use that for a couple of days, and if it calms down the pain, then it's very good. But if acetaminophen or Tylenol doesn't work, then you can move on to non-steroidal anti-inflammatory drugs such as Motrin, Naproxen, Aleve, and other pain medications like that. So once the pain has gone down a little bit, but it's still there, then you can start massaging the area. You can do gentle massage, you can grab lotion, and then you can massage this area here. You can grab 2 fingers. As I've said, the tendon runs from here to here. And then you can massage this area for 5 to 10 minutes, 3 times a day, 2 to 3 times a day, creating blood flow to this area. Blood has nutrients, it has oxygen, and you're just creating a healing environment around your tendon. Another thing that you can do is cross friction massage. Cross friction massage is a type of massage where you're going perpendicular to the tendon. Then you go up and down, or depending on where your orientation is, and you can go left to right. The tendon's right here, right, guys, remember? So from here to here, then you can go left to right, like this, okay? So I could recommend, again, 2 fingers, and then you can just go left to right here, to that area. Make sure it's not painful, because if it's painful, then you're aggravating that area, so back up a bit, okay? I would recommend doing this about 5 minutes every other day. Don't do it every day, just every other day. 2 fingers, put it on that area, and go left to right, or if you're going here, then you go up and down. The reason why you want to do that is because you're allowing your tendons to heal properly. When our tendons heal and we don't do cross friction massage, your tendons tend to heal. They heal, but it's not as strong. One of the main factors that make our tendons strong is collagen. And when we don't do cross friction massage like this, collagen is laid out sporadically, kind of like if you would think about like a blank canvas of paper. Collagen is just splattered all over the place, and it's not as strong, it's flimsy. If you do cross friction massage, you're building that strong foundation for your tendon by laying out collagen fibers nice and stacked, and you're building a good foundation for your tendon, which in turn reduces less pain in the future. Once the pain has gone down, you can grip things a little bit, you move it, you go up like this, it's not painful anymore. Then you can proceed to moving your arm. So what I would recommend you doing first is you can put your hand like so, and you extend your wrist, then you make a fist. Okay, try that. Let's do about 10 times. 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. Take a break, 30 seconds to a minute. Make a fist, extend your wrist. Then you make a fist again, 10 times. 4, 5, 6, 7, 8, 9, 10. Take a break. Extend your wrist again, and then do it 10 more times. 4, 5, 6, 7, 8, 9, 10. Boom. So make sure when you do this, it's not painful. If you feel a little bit of pain when you do this, that's okay. But if the pain goes up to, say, a 5 out of 10, in a scale of 0 being no pain, 10 being the most painful you've ever had, and you're at a 5, then I would back up and not do this yet, because that means your body is not ready. But if the pain is like a 1 out of 10, then you can do it. You grab a weight, any kind of weight would do. If you have dumbbells, even better, but I'm using a roller for now. Extend your wrist. You grab the weight, and then you let your wrist fall, and making sure that you control the weight all the way down. Okay, you don't just let it drop like this. One more time, I'm gonna extend my wrist, grab the weight, go down. One more time, extend, grab the weight, go down. Extend your wrist, grab the weight, go down. Notice that I'm having my wrist at the edge of the table, allowing more motion for my wrist, and I'm getting that full range of motion, which basically means that I'm having my wrist fall all the way down as much as it can. One more time, grab the weight, let it fall all the way down. You can do about 10 repetitions, 10 of those, take maybe about 30 seconds to 1 minute break, and then you repeat 10 more times, you take another break, and then you repeat 10 more times. Then when you get better, you can go up and down, right? 4, 5, 6, 7, 8, 9, 10. And that's it, voila. Just a big picture wise, guys, so you guys don't forget, this is caused by wear and tear of your tendons. So if you could reduce the activity, by all means, do it. If you can't, then do what you can, all right? And also just to give you guys a holistic approach in this, you can definitely watch what you eat, because sometimes food can inflame our joints, especially foods that are high in purine, which can build up in our joints and it can cause inflammation and pain. I'm sure you guys have heard of gouty arthritis or gout. So you can just do a quick Google search and type in what types of foods that are high in purine or can increase your risk of having gout. So on top of my head, I know shellfish, beans, soy, even alcohol can inflame your joints. So just be careful with that. Make sure you're eating your greens, you're drinking plenty of water. That way you're creating a healing environment and increasing the circulation around your body, and you're creating that healing environment around your body. So if all these things that I've taught you doesn't really help out, then I would recommend going to your doctor and ask him about steroid injections or corticosteroid injections that will help reduce the pain. So you can ask him about that. And if you feel like steroids didn't help you too, that you can still feel the pain, you can talk to your doctor or a surgeon about surgery. And that's the last resort. At the end of the day, if I could help you reduce the pain without having to go through the knife and having to go through a surgery, I would have you do that. Okay? Alright guys, that's about it. Take care. Please be safe out there, especially with COVID. Take precautions, wear a mask, wash your hands, social distance. If you can stay outdoors, even better. And open your windows if you can. Hopefully you guys are doing okay. And if you have any questions, feel free to shoot me a comment and I'm here for you.
Pagkatapos ka pa kinabangang bigla lalayo, kaya wag nang uulit pa, kaya wag nang uulit pa.
Tayo, kailan ba matututo? Pag-ibig ay sakit sa ulo, kaya